Well, for more on the striking resident doctors, Dr. Itoha Oaku is the chairman, Association of Resident Doctors, LASUTH chapter. She joins us on the program. Thank you for joining us. I'd like to begin by asking your response to what the Minister of State for Health has said, saying that 20 billion naira has been paid to health workers so far.
Yeah, thank you very much. Good morning. Well, it's been difficult for me to verify those claims. These are figures given by the Minister for Health, and it's going to be very, very difficult for me verifying those claims. But like the president of the Nigeria Association of Resident Doctors have earlier said, we are only aware that 2 months out of the 6 months promised for the COVID-19 inducement allowance have been paid. That's all I can say with respect to the Minister for Health.
It's been a long list of demands in terms of some of the conditions that NARD has been asking for, but we also know that, take for example, Kaduna State today, some of the resident doctors said they were not joining, and this is because the state government has met some of those conditions, like the Residency Training Act, which has been domesticated. For you in Lagos State, is there anything that the state government has done differently?
Okay, thank you. For us in Lagos, we've been having several meetings. It's all about meetings. We had the Salary Disparity Committee that was set up. We had several meetings with them, but as we speak, nothing concrete has come out of it. For the COVID-19 inducement allowance, we've not had any meeting whatsoever to that effect. So there's really no agreement on ground in Lagos for the health workers or for resident doctors with respect to that, not to talk of implementation. For the Medical Residency Training Act, the process is ongoing. We've commenced something, but it's still at a very early stage. It's yet to get to the head of service office, where from there is meant to get to, Mr. Governor, for him to intervene in ensuring a smooth and quick domestication of the act. So it's still quite early. And the last thing, which has to do with the residential quarters, which actually our demand here in LASUTH, residential quarters, we've talked about designs, we've talked about the plans, okay, but no land, nothing concrete, no tangible commitment from the government to say, okay, this is the area that has been earmarked for such a project. So, it's a lot of meetings, yeses, and nothing tangible from, the Lagos State government.
So the government has talked about lean resources, especially the fact that we're fighting the coronavirus pandemic, and we have different sectors of the economy that are also suffering. Don't you think that, perhaps the association as well can see reason from that angle?
Okay, I would to agree partially, okay, with you if the government really is sincere with, if we are sincere with ourselves, because we form the government really. And I will say that you don't take care of your personal needs and you leave critical needs such as the health sector, left hanging or to dilapidate. And we are saying this not just because of our own personal needs as well, because at the end of the day, it's the patient's welfare that we are looking at. So I think there should be a balance when we talk about the resources that are available or not available. What do we channel these resources through? Is it for the posterity of our people, or just for, the personal needs of a few? I think these are things we really need to look at. And if we are sincere with ourselves, we know that government needs to do the needful when it comes to health. And just to say that for resources being scarce, really, how scarce is it when we still can afford so much in terms of what we hear on the news, And really, I don't want to go into that.
All right. An economist has said that Nigeria perhaps is suffering from some comorbidities which has been exposed by the pandemic. But we hope that the meeting today is fruitful. We'd like to thank you, Dr. Itoha Owaku, Chairman, Association Resident Doctors, LASUTH. Thank you for joining us.
You're welcome. Thank you for having me.